Hi, I'm Andrew Styler and I'm here with Dr. Jeffrey Styler, who is our consultant radiologist. Hi Jeff, how are you?
Thank you.
Can you please tell us a bit about your profession and where you work and what it involves?
So I'm a doctor, I'm a consultant radiologist, so I've studied medicine and then I've done another 5 years training after that to become a radiologist. I work both in private practice and at a public hospital. A consultant radiologist is involved with anything to do with medical imaging, which may be looking at images to make a diagnosis. It may be performing procedures on a patient to get a diagnosis, or it may be performing therapeutic procedures on a patient, for example, for pain relief.
Okay. This semester in a subject of mine called Communication for Health Professionals, we're analysing the importance of communication in a professional position, or in my case, in a health role. Can you please give a brief synopsis on the importance of communication in your profession?
So my whole job is communication, whether I'm talking to patients, to ascertain where they have their pain. For example, I may need to know the dermatomes of their leg to know which spinal level to inject. I have to communicate with the persons who are referring patients to me. For example, when I do a report on an MRI, I may have to give quite a long report, and the communication is absolutely essential, or else my report is worthless.
Okay. Well, as a student studying podiatry, I undergo an anatomy subject, and I'm beginning to learn the universal anatomical language, which is often a lot of Latin prefixes and suffixes and other bits in between. Can you please explain to me why it's so important to have a universal language in the medical field?
So the human body is incredibly complex, disease processes are incredibly complex, and the more you study you realise just how complex they are. Unless you know these very specific terms, you will lead to erroneous diagnoses. You may describe a condition incorrectly, and you may even get the anatomy incorrect.
Yeah. It's my understanding that a radiologist, not only do they spend time with patients, but they'll often spend a lot of time in a room at a computer, like going through all the scans and actually analysing them. How many scans would you say you get through a day, on an average day?
So we would see over 100 patients per day.
So how would you communicate effectively but also efficiently so that these cases are processed efficiently and effectively?
So I need to know my job well, so I need to be trained well so that the diagnosis becomes instantaneous, but my reports must be long enough so that the referring clinician gets all the information they need, but short enough that it doesn't take too long for them to read, or else all of the relevant information will be lost in a lot of verbose talk.
Okay. How would you alter your communication, say, when you're talking to a patient instead of the doctor?
So a patient needs to know risks and benefits of procedures, so they don't necessarily need to know every single risk, because some risks are so rare that it would just scare them off having the procedure. You also have to make some sort of judgment as to their understanding of what's being done, their understanding of the condition. So whilst the referring doctor will probably want to know every eventual outcome, the patient may not want to know that.
Can you explain to me how there could be harm in a medical field if you didn't provide adequate communication? Could there be issues for you if there isn't adequate communication and all the details aren't processed?
So the two obvious cases I can think of is allergies. So if we inject something to a patient, they're allergic to that, they could die from that if we don't find that out first. Likewise, if we're performing an MRI and we haven't ascertained that they have an implant such as a pacemaker, they could actually die from the MRI.
Okay. What sort of advice would you give to a student such as myself who's hoping to go into the medical field one day? What sort of advice would you give me in effective communication in the workplace?
Communication is incredibly important, and sometimes it's actually more important than having correct knowledge.
Okay.
So knowledge is also very good about disease processes, but if you can get a good history from a patient and you can talk to the patient, you can talk to fellow clinicians, fellow paramedical staff, the diagnosis may be just about laid out before you.
Okay. Do you have any other advice about any other element in your profession? What sort of advice do you have on communication? How about developing a relationship with a fellow colleague and doing that in a professional manner?
So I think having a relationship with various colleagues will not only make your job easier, but you'll make your job more accurate. If you can help out a staff member, you can communicate with them well, they're more likely to help you out at some other stage.